Hi, my name is Alison Abbott, and today my presentation will be on human immunity. So today's presentation will include describing the first and second lines of defence against disease, using specific examples in section 1. Section 2, I'll explain the third lines of defence as well as self-recognition and tolerance to own tissues and rejection of transplanted organs, looking into more depth into 2 specific immune system disorders. In section 3, I will describe the categories of acquired immunity, the immune response to vaccination, including immunological memory and the concept of herd immunity, vaccination programs and factors affecting vaccine uptake. So, an infection is when a pathogen enters our body and causes an illness, disease or damage. Immunity is our body's way to protect against an infection. The 4 main pathogens are bacteria. These are single-cell organisms which can cause meningitis, cellulitis and strep throat. Viruses rely on a host to reproduce and survive. They're the cause of the common cold and chickenpox. Fungi is a disease on the surface of the skin like athlete's foot, but can also develop in the lungs, nervous system, causing threatening invasive life diseases. Parasites transmit disease by mosquito bites, leading to malaria and Lyme disease. Infections can be transmitted by direct contact, which is person to person, by coughing, sneezing or touching, animal to person via bite and scratch, mother to fetus via the umbilical cord. Indirect contact is when a pathogen lies on the surface of like a door handle, and if we touch it, then it's awaiting contact and then transmitting it to our own body from a touch. Insect bites passing on disease via the carriers known as vectors, and food contamination such as E. coli is caused through water or uncooked food and can cause gastroenteritis or food poisoning. So the first and second lines of defence are there to fight against non-specific types of pathogens using physical and chemical barriers. Non-specific means the defences will respond in the same way to an attack from any type of pathogen. The skin is the body's largest organ, and the epidermis is the waterproof outer layer of the skin. Dermis lies just underneath and contains blood vessels, nerve endings and hair follicles. The deepest layer is called the subcutaneous layer and contains fat cells, connective tissues. If the skin remains unbroken, the physical structures contained within these layers provide an effective physical barrier, slows down the penetrations of organisms, chemical irritants and toxins. The skin has the ability to heal itself by creating a scab when punctured, maintaining the level of protection against invasion. So the mucous membrane lies inside of the body and provides a chemical protection against invasion from pathogens, while still filtering essential nutrients through. These are found within the eyes, ears, nose, mouth, sinuses, throat, gastrointestinal tract, respiratory tract, and urogenital tract and vaginal tract. The membrane in these areas produce enzymes able to kill the pathogens, and these are found in sweat, mucus, tears, saliva, urine, semen, and stomach acids. The nasal cavity is lined with mucus that catches the microorganisms before they can enter the airway. Usually these are sneezed, coughed or blown out, but if any do make it through, the small hairs called cilia sweep away from the lungs to the throat so it can be swallowed and into the stomach. Stomach acid is too acidic for most pathogens to survive, and as well as pancreatic enzymes, bile and intestinal secretions, all found within the digestive tract. Contractions within the intestines help excrete dead or harmful microorganisms. The urinary tract mostly flushes out potential harmful pathogens along with the urine. Bacteria rarely make it to the bladder, especially in males as their urethra is longer. Women have shorter urethras, so pose more of a risk, plus the insertion of medical devices. But again, regular passing of urine make UTIs preventable. A pathogen may still make it past the first line of defence, meaning the body will then initiate an inflammatory response. This is the second line of defence. It's also a non-specific defence, attacking without discrimination. When tissues are damaged, pathogens are able to enter the body. The injured cells will release a distress signal, triggering the release of histamine around the damaged area. The area will become inflamed and warm due to the increased blood flow from the instructed dilation in nearby blood vessels. The heat in the area will have an antibiotic effect, and fever within the body creates a hostile environment for the pathogens, inhibiting bacterial growth and making the immune cells work faster, damaging infected cells but not affecting healthy ones. Platelets and clotting factors work to heal the wound and seal the damaged area, confining the infection and stopping the spread. White blood cells create the pus and a scab. In order to kill the pathogens that have entered the body, white blood cells called monocytes enter the infected site and differentiate into macrophage cells to begin the process of phagocytosis, which is the process of engulfing and destroying damaged, defective or invasive cells. And macrophage cells can engulf up to 100 pathogenic cells. Once engulfed, the pathogen is enclosed within a large vacuole inside the macrophage called a phagosome, then fuses with lysosomes to create a phagolysosome, which contains digestive enzymes that break down most of the pathogen structure. Macrophages are known as antigen-presenting cells because they keep the antigen of the pathogenic cell, join it to a protein and display the antigen on the cell surface membrane for other cells to recognise the antigen of pathogenic cells. So as we know, a pathogen is an infectious agent like bacteria, fungus, virus or protozoans. Antigens are the part of the pathogen formed as protein, carbs, nucleic acid or fat that is needed to initially help the pathogen enter the cell, but it communicates with the cells in the body, informing them of an attack. This initiates the immune response, which is the reaction that occurs specifically to defend against harmful and foreign invasion. The third line of defence are the immune cells that target specific antigens. Acquired immunity is not present at birth, but it's developed over time as the body learns how to attack a specific antigen. As it encounters various antigens, it learns how to attack, adapt, and then remembers and stores the information for next time. Artificial acquired immunity usually comes from human intervention like vaccines, and the body uses the same process to remember how to defeat the invasion. Active immunity is what develops from the response to an infection or a vaccine. Passive immunity, however, develops after you've received the antibodies, either naturally from a mother's breast milk or artificially from injections. White blood cells are known as leukocytes. They are produced in the bone marrow and are all involved in defending the body against infection. There are 5 different types. Neutrophils are the most common, medium in size, and they're usually the first to reach an area. They're attached to the walls of the blood vessels and act out phagocytosis. Monocytes are what we spoke about before. They're the largest, and they also act out phagocytosis, but on a larger scale. Eosinophils, these release toxins that kill allergies, parasites, and worm invasions. Basophils are the rarest and they're not antigen specific. They release anticoagulants and antibodies into the bloodstream against hypersensitive reactions. And lymphocytes, these are small with large nucleus, but they play a part in antibody production using B and T cells. So lymphocytes, they're the front line and they produce the 2 types of cells, the B and T cells. T cells are made in the thymus and their role is to surround, bind and kill an invader. They're activated when antigen-presenting cells, like we saw earlier with the macrophages, present the antigen on the surface of the T cell, to the T cell, which then releases many more T cells into the bloodstream, destroying the invaders. Helper T cells regulate the immune functions in the body. Cytotoxic T cells create proteins and enzymes that destroy cell structure by attaching itself and injecting directly inside, causing it to self-destruct. Suppressor T cells ensure the helper and cytotoxic cells do not cause excessive damage to the rest of the body's tissues. So then B cells identify the foreign invasion. They activate the T cells and they present the T cells with the antigens and also release in large amounts of antibodies. Memory B cells live in the lymph nodes awaiting activation again if required. So basophils are responsible for creating 5 different types of antibodies called immunoglobulins. The structure consists of chains being arranged in a Y shape, so the smallest part can bind to antigens. They have many different roles, including targeting infections, removing antigens, neutralising toxins and stimulating cells that act out phagocytosis. Immunoglobulin G can stimulate a direct attack. It can also be transferred from mother to fetus via the placenta, giving it some protection before it's been exposed. Immunoglobulin A is present in mucous surfaces like the mouth, creating a cellular defence. M has a different structure, has 5 monomers, creating a pentamer, and is the first antibody to respond at the scene. E is the largest and releases histamine, tackling parasites and allergic reactions. And D may function as an antigen receptor on the surface of B cells. So in order for the immune system to recognise when a cell is itself or non-self, it displays an antigen on the cell membrane. If it's not recognised by the T cells, then it will respond to attack. Antigens that are similar to human antigens will create a weaker response than those that are different, which create a stronger response. Major histocompatibility complex molecules, or MHC molecules, have 2 systems. MHC1 molecules are displayed on the surface of the cells with a nucleus presenting antigens to the cytotoxic T cells. These can be found on nearly every cell in an organism and will bind a healthy cell to the surface. The protein complex on a healthy cell will be recognised as a self-antigen and be left alone. The leukocytes can distinguish between self and non-self, so it identifies an infected cell and produce and display an antigen, enabling it to be destroyed. MHC2 molecules are restricted to only the immune system cells like macrophages and B lymphocytes. They present antigens to the helper T cells, and the leukocytes are able to communicate with each other to produce more specialised cells. To succeed with a successful organ transplant, doctors will need to ensure the correct compatibility of these MHC proteins between donor and recipient, otherwise recipient's body will reject and attack new organs as it will be identified as non-self. A transplant is removing cells, tissues and organs from one person to another, usually for life-saving surgery, to replace unhealthy organs with healthy ones from a recently deceased person. The recipient's immune system may recognise the new organ as foreign, even after doctors will match tissue types as closely as possible. All patients will have an immunological rejection, except identical twins who share the same DNA. So monoclonal antibodies can be used to eliminate T cells which may reject the organ. There are 3 types of rejection. Hyperacute rejection, this is immediate. The body will instantly reject it, fall ill, and it's usually due to a different blood type. Acute rejection, this takes between 1 week and 3 months for the cells to reject the organ, and chronic rejection is a slower process. It occurs over years and the immune system slowly damages the organ. The process of eliminating self-reacting lymphocytes fails. If it fails, then B or T cells may activate against self-antigens. Antibodies will react and attempt to destroy self cells, and this is the basis of an autoimmune disease. Hypersensitivity is the occurrence of an abnormal immune response caused by repeated exposure to the same particular antigen, and these are grouped in 4 categories by their underlying causes. Type 1 is immediate hypersensitivity, like an allergic reaction. Type 2 is antibody-mediated hypersensitivity, so for example drugs, medication from a penicillin allergy. Type 3, immune complex mediated hypersensitivity, like an inflammatory response like arthritis. And type 4, cell-mediated hypersensitivity from excessive immune reaction, for example MS. If a healthy person has an autoimmune disease, their immune system will attack healthy cells within the body, causing symptoms like fatigue, inflammation, fevers and muscle aches. This can occur in any part of the body and the cause is unknown, although it can be hereditary. Unfortunately, these diseases can rarely be cured, only managed. One of the more common immune system disorders is rheumatoid arthritis. This is a long-term autoimmune disorder affecting the joints all around the body. The immune system sends antibodies to the cells lining the joints, called synovium, to attack, and as they do not recognise the antigens. This causes flare-ups of soreness, stiffness, redness and inflammation, and a release of chemicals which damage nearby bones, cartilage, tendons, ligaments, eventually destroying the joint completely. There is no cure. Physiotherapy is recommended alongside some medications which can slow down the process. In some cases, surgery is available to repair the joints. Another disorder is multiple sclerosis. This time the immune system attacks the brain or spinal cord of the nervous system, specifically the myelin sheath surrounding the nerves. If the nerves underneath become damaged, this distorts and slows the messages being sent via the nervous system from the brain, which can affect the function of the whole body. Causes are unknown, but chances are higher if a family member has had the disorder, and there have been links to lack of vitamin D from sunlight, smoking and being a woman. Symptoms can vary: fatigue, vision problems, muscle spasms, mobility issues, pain, processing thinking and organising skills, depression, bowel issues, just to name a few. Treatment is more focused on treating and alleviating the symptoms rather than the actual cure. Increase in exercise, better sleep patterns, physiotherapy, antidepressants and therapy are among some suggestions, depending on the symptoms, as most sufferers will only experience a few symptoms. Steroid medication can also be described in short doses. I briefed earlier in the presentation about acquired immunity. This occurs either naturally, passively via mother's milk to newborn, or artificially, passively via an injection or transfusion. This immunity is immediate but short-lived, as the antibodies have already been made, they've just been transferred, and this can cause side effects called serum sickness. Active immunity is not immediate. It can take time to develop as the antibodies are being developed, but it has longer lasting effects. Contracting an infection is naturally acquired, but the exposure to antigens and pathogens within a vaccine is intentional, and artificial causing the active immunity process. So vaccinations expose weak or harmless pathogens into the body. So white blood cells will produce the antibodies to destroy them, with the intention of those antibodies to remember the pathogen for future protection. This is called immunological memory and is the main reason behind vaccinations. Vaccines can include live pathogens, and these are treated in a way to make them harmless before they enter the body. Harmless components or segments of a pathogen, toxins from a pathogen, or dead pathogens. The immune system will detect these as foreign antigens and stimulate the immune response. The vaccine will not include the full pathogens, just weaker adaptations of it, so the body should not develop full disease, but may suffer mild effects while the antibodies are at work. When a pathogen is encountered for the first time, symptoms are more likely to occur whilst the appropriate antibodies are being produced. Memory cells are also produced at this time. If the body encounters the pathogen for a second time, the response is much quicker as they recognise the pathogen and produce more antibodies a lot quicker, usually before any side effects have had time to take effect. Vaccines have varying timescales of protection depending on the disease. The NHS offer flu vaccines before every winter, and just recently the COVID-19 boosters have been offered annually, which has dropped contraction rates dramatically. The polio vaccination offers protection for 18 plus years, with boosters being offered if travelling to certain countries. Compared to the smallpox vaccine, which has now completely eradicated the disease, and the World Health Organization declared that no cases have been reported since 1977. So, diseases are spread from person to person in varying transmission methods. But if a large percentage of the population is vaccinated, therefore protected against the disease, it's harder for it to spread, resulting in it disappearing. To work, a large number of the population must be vaccinated, so the contagion cannot pass as freely, as this is herd immunity. As our world is more globally connected than ever before, herd immunity is more difficult to achieve nowadays. Some infectious diseases can be caught from the environment as well, instead of person to person, and some people will become infected before a vaccine has time to establish. Not everyone will get a vaccine due to age, health, religious and ethical beliefs. And as we saw recently during the COVID-19 epidemic, some people are anti-vaxxers. Purely from stories spread throughout the media, they could be concerned about the long-term potential side effects the vaccine cause, like cancers or even autism. But one of the stories that insinuated was that it was a government conspiracy to track us via implants within the injection. The immunity threshold must be suitable as well, dependent upon the disease itself. There can be hundreds of variations of a pathogen being presented, like the common cold, for example. Herd immunity would not be effective in this instance. For it to work, a large percentage of the community must be vaccinated, and this depends on how infectious the actual disease is. So, for example, the production number for measles is 12 to 15, meaning one infected person can infect that many people. So 83 to 94% of the population must be vaccinated for herd immunity to be effective against measles. So safety is a huge factor, and it's the public's choice whether they allow themselves and their children to be vaccinated. Vaccination programs are run within the NHS clinics and pharmacies, making them more accessible and available for convenience. Early childhood vaccinations have proven to be extremely effective, slowing and eliminating the spread of infections and disease. So vaccination programs in schools are run by health visitors and nurses at specific ages for children, and it's been scientifically proven that vaccines are a preventative, but as mentioned before, some people still choose against this route, worried about side effects like autism and cancer. Benefits of being vaccinated include the cost of the vaccination programs are significantly less than treating the actual disease itself. Without vaccinations, the spread of disease would be fatal and life expectancy would not be as high as it is today. Vaccines can be a preventative from some cancers like HPV virus and hepatitis B with liver cancer. And vaccines have eradicated some diseases completely, and although some still do exist, the rate is low and it's treatable. And diseases can develop further complications, and the vaccinations can eliminate these complications as well. So although side effects can occur, the benefits of vaccinations and the research behind the programs outweigh those side effects. So thank you for listening to my presentation today.